Right now, we're going to enter into Module 2, talking about the characteristics of Alzheimer's disease. The objectives are to go through the stages of Alzheimer's, the symptoms and behaviors associated with each stage, and the challenges of caregivers at each stage. So we are going to see the following video, and this is delivering the diagnosis of Alzheimer's disease.
Hi Sam, nice to see you.
How are you?
Good. How are you doing?
Good.
Good. Hi Lydia.
Okay,
Glad you're here.
thank you.
So Sam, the purpose of our visit today is to go over some of the test results from the memory workup that we did a few weeks ago. So a while ago you came into the clinic because you and your family were a little bit concerned about how you had been doing recently in terms of your memory. And so we wanted to figure out and get to the bottom of things. And so we ordered a number of different tests. So today, the goal is to tell you about the test results, answer questions that you have, and talk about what happens next. Sound like a good plan?
Good.
Okay. So one of the first things that we did was we ordered some labs. We had you give us some blood so that we could look at that. And the purpose of the lab tests was to make sure that you didn't have any vitamin deficiencies or other problems that could explain some of the memory difficulties that you had. But your labs came back completely normal. No problems there. Okay? The next thing that we did is we took some pictures of your brain. We did some neuroimaging. You remember doing that?
Mm-hmm.
Yeah, the big machine. And so we got a lot of pictures of the tissue in your brain. And the purpose of that is to make sure that you didn't have any strokes or other problems that could be the reason for why you've been having a little bit of difficulty with forgetfulness. But the brain scan was also essentially normal. There was a little bit of shrinkage, but not much more than would be expected for somebody of your age. Okay, and we didn't see any strokes or any other obvious problems there. Okay, so lab tests were normal. The brain scan was essentially normal. The other thing we did was we did some memory testing with you. So do you remember when you were here last, you were working with the nurse for a little while. She was asking you some questions about your memory, asking you to remember things, draw some things. And on that test, you struggled a little bit. And so, our testing was consistent with your own observation that indeed you're experiencing more memory problems than what we'd like to see, more memory problems than what would be considered normal or healthy for somebody of your age. And then between now and then and now, I also spent a lot of time looking through your medical record, your medications, trying to look at other things that we could use to explain some of the memory problems. What we do in the end is take a look at everything in aggregate, and the end result is that your memory loss looks to be explained by Alzheimer's disease. Okay? So I'm going to talk to you a little bit about what that means and what we're going to do about it. But before I do that, I want to check in with you and find out what your thought is and if you have any questions about that.
Well, my thought is, as you go along, can you let me know what is going on and what can I do about it on an ongoing basis?
Right.
But more than anything, I want to know what's going on. I want to keep current with what is coming up.
So you're a proactive guy, which is why you came to see us to begin with, because you noticed some memory difficulties, which was a good thing. I'm glad that you did that, because now that we know what it is, we know what we're dealing with, and we can give you a lot of strategies for living well, okay? So we're also going to take a proactive approach, and I'd like to see you at least every 6 months so that we can keep tabs on you. We can talk and see how you're doing and do some smaller tests along the way to keep track of your condition, okay? So we're going to be proactive, we're going to stay ahead of the curve, and we're going to be talking as we go along about different strategies to keep you well, okay? Lydia, what about you? Any thoughts, reactions, or questions?
how long does it take for you to go from the beginning phases to, really bad condition where you need to be put away?
Mm-hmm.
Thank you.
Yeah. I know it's a hard conversation to have. This is not what you wanted to hear coming
The word is so scary.
Mm-hmm.
It's a bad word.
Right. Yeah, the A word, as we call it, Alzheimer's, it is really scary. In the last couple of years, researchers found something interesting, which helps to answer your question, which is that by the time somebody starts showing signs or symptoms of memory loss, the Alzheimer's disease pathology has been moving around the brain often for more than a decade. So this tells us that this is a pretty slow-moving condition. It takes a decade or more of problems in the brain before most people start to show signs and symptoms. So as best we know today, the progression continues at that slow rate. So if you asked me, Sam, am I going to notice big changes a year from now? The answer is that for most people, probably not. Or if you do, the changes will be pretty minimal. And we're going to talk about all kinds of strategies to make sure that you're doing well. Now, there is no cure for Alzheimer's, but there are a lot of things that we can do. And we're gonna, like I said, be proactive with you. A lot of people ask about medication treatment. Is there any medication that we can take to help the condition? And there is some medication. And today we're going to talk about the pros and cons of those treatments and whether you'd be a good candidate and whether you're interested in doing that or not. Okay.
I don't know. I'll wait for your progressive checks.
Yeah. Yep. So we'll talk about that a little bit today. The other thing that I want to make sure that you know about is that in addition to medication, there's a lot of other things that you should be doing, Sam, to make sure that your brain is functioning at an optimal level, okay? And so we're going to talk about some of the wellness strategies. There's been a lot of research done on things like exercise, keeping socially active, keeping mentally active. And so I'm going to give you some resources today so that you know exactly what you need to do from this point forward. And we'll check in about that as we go along, okay? A lot of people also, because this diagnosis can be a little bit overwhelming, you may have questions that pop up in your mind a couple days from now, a couple weeks from now, or down the road. And I want to make sure that in addition to being able to call me, you have people that you can count on to help you through that process. And so the other thing we're going to do is I'm going to connect you with our social worker from the Alzheimer's Association, who's an expert in memory difficulties and has a lot of information about community resources and support. And Lydia, some of those things focus on you as the care partner, the person who's helping to support Sam. So we're going to make sure that you're well taken care of and have the information that you need, okay? Sam, let's get started and talk about the plan, okay?
Okay.
Okay.
So the video is an actual patient, doctor, and family interaction. And this man actually received his diagnosis of Alzheimer's, and you can see the reactions or their different reactions on the video. So it is very important to get an early diagnosis of Alzheimer's. Some people are very reluctant to go to the doctor when they or a family member has memory problems. And of course, that is understandable. Some people will hide their symptoms or family members will cover for them. And that's very easy to understand because Alzheimer's dementia is associated with loss. It is a loss of independence, a loss of self, and really a grieving process. Many people may wonder if there's any point in a diagnosis if there's no cure for the disease. Now, it is true that if you have Alzheimer's, doctors can't offer a cure, but getting an early diagnosis can be very beneficial. For example, you will have access to treatment options. So while the medications do not prevent, stop, or reverse Alzheimer's, they can help tremendously in the beginning stages especially. They help lessen symptoms such as memory loss and confusion. And it's to be understood that this is for a limited time. An early Alzheimer's diagnosis provides you with a better chance of benefiting from treatment. A second benefit to early diagnosis is the chance to prioritize your health. So some lifestyle changes such as controlling blood pressure, quitting smoking, participating in exercise, and staying mentally and socially active may help preserve cognitive function according to research. Also, there are emotional and social benefits. Receiving an early Alzheimer's diagnosis may help lessen anxieties about why you are experiencing the symptoms. You will know at least why. And you and your family will have the opportunity to maximize your time together and to access resources and support programs. Imagine even taking your loved one on the trip you've always dreamed about. And if you would get the diagnosis 2 years after that, that might not even be possible. There's also more time to plan for the future. Planning ahead allows you or your family member to express their wishes about legal, financial, and end-of-life decisions. You will be able to review and update legal documents, discuss finances and property, and of course, identify care preferences. There can also be potential safety issues that can be addressed and understood at this early stage, such as driving or wandering, and the decisions can actually be made ahead of time. There's also significant cost savings. Early diagnosis saves the cost of medical and long-term care for families. This next slide I want to show you shows the natural history of Alzheimer's disease. On the left column, you can see the mini mental status examination score and the years of Alzheimer's. Remember, it's an average of 4 to 8 years after diagnosis. But of course, there's many factors, so it can be up to 20 years. I know my grandma lived probably 15 years or so after her initial diagnosis. But you can see how it progresses. So the early disease entering into the mild, moderate, and then severe disease.
Pretend you're driving in a car and you're going down a road. And it's a beautiful day. The trees are all in bloom in different colors and the sun is shining. But then when you round a bend, you hit a fog bank. And so your natural reaction is to just slow down and proceed very, very slowly. And you just keep going like that until the fog clears. After the fog clears, then you continue on until you round the next bend, and then you hit another fog bank. Fog is the best way that I can describe what happens. You go through all these things, and you have to remember. I can't. I'm having my moment. Yeah, gotta remember what I said. I'll just make it up as I go. I get what I call brain fog.
Hey Alexa, what's my schedule today?
You need to eat breakfast at 9 a.m. Want me to remind you?
No thanks.
It could happen 2 times, but some days it happens 10 times. Some days it happens so many times that I'm not able to do anything for the whole course of a day. You can't get a thought from here to come out in a verbal way. And so it becomes one of those quiet days where I can't really do much of anything except sit. I don't really need to walk. because I walk at least 5 miles inside every day, going from room to room, trying to find something, and I can never find it. It's kind of like you walk and your mind just, it doesn't just go blank, it's just nothingness. Just completely barren, completely empty. You can't remember anything. And that's the scary part. You can't remember anything. My ex-wife and I were sitting there, and the doctor walked in, and then he starts giving me the results. He started going into other things, and my mind was spinning at this time. And I just stopped him. I said, listen, I said, what I really want to know is, do I have Alzheimer's? And he paused, and he said, yes, you have what we call early onset Alzheimer's disease. Now, that was the last thing that I heard, because I just lost it at that point. When you know what your end is going to look like, you don't want to know that. You just don't. So you try to put it out of your head. But at least once a day you're reminded of it. But in those beginning days, it's dark. The one thing that I just thought of is that sometimes I watch other documentaries, and there's always the crying scene. And I get it. I get why. After my diagnosis, I went home and I spent like maybe 3 days of feeling sorry for myself. But then I had sort of a premonition. I was facing this huge guy. The bell sounded, we came out, and with one hit, he hit me square in the chin, and I fell out. And the referee started counting me down from 10. I didn't want to get up, because I knew if I got up, I was going to get hit again. But then something else told me, if he reaches 1, you're out. Really out. And that scared me. So he kept on going down and counting down and counting down. I just started getting anxious and anxious and anxious. And when he got to 2, before he could get to 1, I sat up. I opened my eyes, and I was actually sitting up in the bed. And I thought, okay, somebody's trying to send me a message here. So I gotta get up. Alzheimer's is a very, very devastating thing. And if you allow it to consume you, it can bring you to dark places. So instead, I always look for the brightness. I always look for anything that can make it less than what it is. And humor seems to do that for me. I tell everybody that I do date, and I have 2 girlfriends. One is named Siri, and the other's name is Alexa.
It's time for your medication, Brian.
Because without those, I would literally forget. And that's why Alexa reminds me at certain times of the day to take a bath.
Want me to remind you?
Not right now, Alexa. Thank you.
When today should I remind you?
Don't worry about it.
Great.
That was pretty good. Everybody has their favorite place. Mine is Walt Disney World. Because I feel like I am normal there. I can't remember one time in Disney when I have had a foggy episode or anything. It's funny, people will stop me and say, hey, could you tell me how to get here, there, and so forth? And I'll give them directions. I'll say, yeah, go this way, this way. And as they walk away, I think to myself, they have no idea they just asked a guy with Alzheimer's how to get how to get to a place in Disney World. I had this aha moment. I was on Main Street. To my left was Casey's hot dogs, and staring in front of me was the castle. I could smell popcorn, and then the music. When I stopped to realize how important that place was, that after 40-something years, I can still find my way around. I can go anywhere in Disney and be at peace. Just from looking at a picture, you have all these memories that just come flashing back. Some memories you don't really want to remember. The presentation that I created is called Alzheimer's Up Close. There's no better way to understand Alzheimer's other than hearing from a person who has it. And quite frankly, it sucks. It's the hardest thing that I've ever had to do. I talk about it all the time to whoever's willing to listen so that they will get
Is Alzheimer's Up Close.
the truth. I don't know what else to do except for that.
And I'm one of the many faces of Alzheimer's disease. I was diagnosed in October of
And at that point, I realized exactly what I was doing, that I was being a voice for them.
My mother was still living with Alzheimer's disease.
I was being a voice for people that were no longer here, including my mother. I've got to fight every single day, and it's exhausting just to stay cognitively aware.
Amazing grace.
I watched my mom go from this smart, vivacious woman, didn't do anything wrong in her life, and then she got Alzheimer's. That's what scares me, is I'm going to lose my abilities. That's what scares me so much about going into the fog, is that someday I'm not going to come out of it. I'm going to stay there. I don't want that to happen. That's why I fight. I fight every day.
And as you can see, there are so many overlaps in symptoms between this preclinical stage and early stages. So there can be confusion with time and location. There can be difficulty completing familiar tasks, misplacing items, difficulty solving problems, memory loss, poor judgment, withdrawal from social activities, trouble with images and spaces, unfounded emotions, and difficulty with words. So let's get into the specific stages of Alzheimer's. It is worthy to note that some references describe 7 stages of Alzheimer's. However, the majority of medical references, including the Alzheimer's Association, detail 3 different stages of Alzheimer's. Symptoms in this first stage of Alzheimer's include difficulty learning new material, decline in recent memory, difficulty performing tasks. The appearance can deteriorate, decreased concentration and judgment, time disorientation, difficulty finding words or even naming objects. In this stage, since the individual is usually aware of their forgetfulness, they may withdraw socially and have feelings of shame, helplessness, and frustration. As Alzheimer's disease progresses, the individual may experience greater memory loss and other cognitive difficulties. Residents with early Alzheimer's may wander or get lost, struggle with handling money and paying bills, repeat questions, taking longer to complete normal daily tasks, and personality and have behavior changes. This is when Alzheimer's disease is often diagnosed.
I always have considered myself a really fiercely independent woman, and I've found out that it's okay to ask for help and that there are a lot of people willing to help that you would have never guessed would have been there.
Through the process, through the journey that I've been on, I've learned that I'm stronger than I think. I've learned to ask others for help. I think it's easy to offer to help others, but sometimes it's more difficult to ask for help.
What I've learned about myself after being diagnosed is that I'm an extremely strong person. This may sound really strange, but I am the happiest I've ever been in my life since I've been diagnosed.
I think the biggest thing I've learned about myself is that I can still do things. I can still do the things I enjoy. I can still learn things. And just to stay engaged and to live life today.
I think accepting a diagnosis is a process, and everybody faces that differently. But for me, I had to mourn my old life and embrace my new life. And part of that was moving from why me to what next.
I just concentrate on what I did today, what I'm going to do tomorrow, and what comes will come.
In order to accept your diagnosis, I think the first thing you have to do is to not isolate yourself. Surround yourself with other people who you can interact with. That really will make a difference. It did for me.
I think day by day, week by week, it just starts getting easier. It's like losing someone. And so I think I've gone through all the grieving stages, and so the shock is gradually wearing off, but every once in a while it rears its ugly head and I deal with it.
There's life after an Alzheimer's diagnosis. I didn't believe it in the beginning, but I found it to be true.
I remember that I couldn't even say the word without just completely breaking down.
I didn't expect to feel the sadness that came with the diagnosis. I mean, it really was overwhelming. And I think it had to do with fear. Who was going to take care of me?
When I received my diagnosis, in many ways I was relieved. While it was difficult news, at least I knew what I was dealing with.
It was very difficult to digest that diagnosis. I said to my wife, I said, I want to do something about this. I don't want to sit back and not do anything. I immediately reached out to the Alzheimer's Association and I said, what can I do?
You know, allow yourself time to be angry, you know, to be afraid. You know, give yourself time to grieve, give yourself time to be mad, and then you just kind of pull yourself back up.
In the middle stage of Alzheimer's disease, damage occurs in areas of the brain that control language, reasoning, sensory processing, and conscious thought. Memory loss and confusion grow worse, and residents with Alzheimer's disease can begin to have difficulty recognizing family and friends. They may be unable to learn new things, carry out multi-step tasks such as getting dressed, or coping with new situations. In addition, residents of this stage may have hallucinations, delusions, and paranoia, and even may behave impulsively. And in the late stage, ultimately these plaques and these tangles spread throughout the brain, and the brain tissue shrinks significantly. The last stage is an almost complete deterioration of bodily function, personality, and behaviors. Residents with Alzheimer's disease cannot communicate and are completely dependent on others for their care. Near the end, the resident with Alzheimer's disease may be in bed most or all of the time as the body shuts down. The Alzheimer's disease patient will have good and bad days. But the most difficult reality is that the disease becomes unmanageable over time. And most residents with Alzheimer's disease will eventually need specialized care. Cognitive impairment leads to difficulty with basic activities like going to the bathroom or washing. And sometimes things as simple as getting dressed can become a challenge. An individual with Alzheimer's or dementia might not even be safe at home eventually. Now, the goal of treatment in all of the stages of the disease is to produce an environment in which the patient can function with minimal failure and retain maximum ability. We want the patient to maintain their independence in as many ways as possible for as long as possible. So regardless of the degree of progression, the goal should always be to preserve available function and maintain current abilities. So there is a concept in caregiving, which is function-oriented care versus custodial care. And functional care is the goal of care. Excess disabilities occur when we do more for the patients than they really need. Custodial care can take away the opportunities to preserve abilities. So let's look at some examples of function versus custodial care. Function-oriented care would be walking the patient with assistance to meals. Custodial care is just wheeling the patient in the wheelchair to meals. Function-oriented care would be one-on-one and group activities, so keeping them involved. Custodial care includes lining up the residents in front of nursing stations. Function-oriented care would only be assisting as needed. Custodial care would be dressing the patients, grooming the patients without allowing them to try to do it. Function-oriented care would be ambulating with assistance or walking with assistance. Custodial care is just keeping patients in a chair all day. So again, basic care in early Alzheimer's disease is focusing on maximizing independence. In the early stages, most people can function independently. They may even still drive or take part in social activities, volunteer, and even work. So one's role as a care partner is an important one. It's to provide support and companionship and help plan for the future. It is also common that a patient in an early stage may need cues and reminders to help them with memory. Again, as a care partner, it may be necessary for you to take initiative to determine how you may be able to help. For example, he or she may need help with keeping appointments, remembering words or names, recalling familiar places or people, managing money, keeping track of medications, planning and organizing, transportation. And again, always focus on the person's strengths and how they can remain as independent as possible and establish a strong channel of communication. Consider ways to work together as a team. For example, if they are so comfortable balancing a checkbook, you may offer to provide a final review. Now, how can we maximize independence in the moderate Alzheimer's stage? The middle stages of Alzheimer's are typically the longest, and they can last for many years. And as dementia progresses, the person with Alzheimer's will require a greater level of care. During this time, it's important to get the support you need as a caregiver. Being a caregiver for someone in the middle stages of Alzheimer's requires flexibility and patience. As the abilities of the person with Alzheimer's change and functioning independently becomes more difficult, you will have to take on greater responsibility. Daily routines will need to be adapted, and structure will become much more important. So there's a lot of concerns that people have in this middle stage. The changes in behavior can be some of the most distressing for caregivers and family members. During the middle stages, people may experience depression, anxiety, irritability, and repetitive behaviors. As the disease progresses, other changes may occur, including sleep changes, physical and verbal outbursts, and wandering. Understanding what behaviors are common during this stage and how to assist the person with dementia can help. Communication is a concern during the middle stage, as people with Alzheimer's gradually lose their ability to find words, express thoughts, and follow conversations. They also have more difficulty understanding others. Communication changes during the middle stages include trouble finding the right word, repeating questions, losing the train of thought, reverting to a native language, and relying on nonverbal communication. You can help improve communication by making simple changes, such as speaking slowly and distinctly in a gentle tone. If you notice sudden changes in communication, make sure to contact the doctor, since this could indicate other medical issues or even side effects of a medication. There are also concerns about daily care needs. Eating, dressing, and grooming will become more challenging as dementia progresses. This loss of independence and privacy can be very difficult for the person with dementia, and your patience and sensitivity will go a long way in helping him or her through it. Once your assistance is needed to complete daily tasks, think about the person's abilities. Encourage the person to do as much as possible, but be ready to help when needed. For example, when dressing, you can give direction indirectly by laying out clothing in the order in which the item is put on. Also, do activities that provide meaning. In addition to enhancing quality of life, activities can reduce behaviors like wandering and agitation. You don't need to invent new things to do. Think of activities as things we do as part of our daily living. Activities can be making dinner together, gardening, listening to music, and going for a walk. My grandma enjoyed playing Rummikub, and she could play it very well into the moderate stages of Alzheimer's. As the moderate stage progressed, she would need certain cues and we would help her out, but that's something that she could still do. Also, when I worked in a long-term care facility, I would sing often with the patients, the old songs like I've Been Working on the Railroad, or if they had been church-going folk, we would sing old hymns. And that was something that even though they couldn't even remember their family members' names, they remembered the words to the old songs. Another major area that will need to be addressed during this moderate stage of Alzheimer's is driving. So during the middle stages of the disease, a person with Alzheimer's will need to stop driving. When it is clear that driving is no longer safe, try to involve the person with dementia in the decision to stop. Explain your concerns by giving specific examples and assure the person you will do everything possible to make rides and transportation available. Now, other safety concerns in these middle stages of dementia is that it will become too difficult or dangerous for a person with Alzheimer's to be left alone. Preventing wandering becomes a crucial part of care, and safety precautions will need to be taken throughout the person's living environment. At this point, if the person is living alone, he or she may need to move in with relatives or to a residential care setting. I want you to also be aware that there are products available for wandering. For example, there are GPS tracking devices that can be installed on a cell phone or even a watch. There are alarm kits or sensors. You can install cameras to check on the loved one at home if a family member has to work. And of course, in long-term care facilities, all of these systems will already be in place. So I'd like to give some quick tips for caregivers. Learn what to expect in the middle stages of the disease so that you can be prepared. Always use a calm voice when responding to repeated questions. Respond to the emotion instead of the specific question. The person may simply need reassurance. And use simple written reminders if the person can still read. Technology can also be very helpful. For example, there are voice-activated technology devices such as Google or Alexa. They have remind features which can be set up to remind your loved one whenever it's time to take their medication. It can also keep a calendar and keep track of lists such as grocery lists or shopping lists. Alexa or Google can also play music and save favorite songs for your loved ones. They would just need to say play favorites, and all of those oldies would already be on there. These technologies are also very helpful in answering questions. For example, who's the president? What day is it today? What's the weather like outside? And that can be very helpful with people with dementia. The third stage is late Alzheimer's disease. This late stage may last from several weeks to several years, and as the disease progresses, intensive around-the-clock care is usually required, and this is when advanced care should be considered. During the late stages, the role as a caregiver focuses on preserving quality of life and dignity. And although a person in the late stages of Alzheimer's typically loses the ability to talk and express needs, research tells us that some of the core of the person's self may remain. This means that you may be able to continue to connect throughout the late stage of the disease. In the case of my grandmother, I would visit her every 1 to 2 weeks with my son. And she didn't remember the name of her children. She didn't remember the name of her grandchildren, but she always remembered that little boy. And when my mother would go and visit her, she would always ask about, quote, that little boy. So she would remember him even though she didn't remember the rest of us. And I believe it's because he gave her great joy during these late stages of Alzheimer's. Since care needs are extensive during the late stage, they may exceed what you can provide at home, even with additional assistance. This may mean moving the person into a facility in order to get the care needed. Now, at this point in the disease, the world is primarily experienced through the senses. You can express your caring through touch and sound, sight, taste, and smell. For example, try reading his or her favorite book. For example, try playing his or her favorite music, or reading portions of books that have meaning for the person. Look at old photos together. Prepare a favorite food. Rub lotion with a favorite scent into the skin. Brush the person's hair. Sit outside together on a nice day. You can do your loved one's hair or give them a manicure and a pedicure. They're all different things that you can do to connect with your loved one. Nourishment is also very important in late stage Alzheimer's. So allow plenty of time for eating and try these tips. Make sure the person is in a comfortable upright position, and to aid in digestion, keep the person upright for about 30 minutes after eating. Adapt foods if swallowing is a problem. Choose soft foods that can be chewed and swallowed easily. Thickened liquids such as water, juice, milk, and soup by adding some cornstarch or an unflavored gelatin can sometimes be helpful also. And you could also buy food thickeners at the pharmacy or a healthcare supply store. Try adding pudding or ice cream or substitute milk with plain yogurt. Encourage self-feeding. Sometimes a person needs cues to get started. So begin by putting food on a spoon or gently putting his or her hand on the spoon and guiding it to the person's mouth. Serve finger foods if the person has difficulty using utensils. Assist the person with feeding if needed. Alternate small bites with fluids. You may need to remind the person to chew or swallow. Make sure all food and fluid is swallowed before continuing on with this next bite. Encourage fluids. The person may not always realize that he or she is thirsty and may forget to drink, which can lead to dehydration, which is a huge issue in the elderly. If the person has trouble swallowing water, try fruit juice or gelatin, sherbet, or soup. And always check the temperature of warm or hot liquids before serving them. Monitor weight. While weight loss during the end of life is to be expected, it may also be a sign of inadequate nutrition, another illness, or medication side effects, and see the doctor to have weight loss evaluated. Difficulty with toileting is very common at this stage in the disease. The person may need to be walked to the restroom and guided through the process. Incontinence is also very common in late-stage Alzheimer's. To maintain bowel and bladder function, set a toileting schedule. Keep a written record of when the person goes to the bathroom, when and how much the person eats and drinks, and this will help you track the person's natural routine, and then you can plan a schedule. If the person is not able to get to the toilet, use a bedside commode. Limit liquids before bedtime. Limit, but do not eliminate liquids at least 2 hours before bedtime. And be sure to provide adequate fluids for the person throughout the day to avoid dehydration. Also use absorbent and protective products. Adult disposable briefs and bed pads can serve as a backup at night. Monitor bowel movements. It's not necessary for the person to have a bowel movement every day, but if there are 3 consecutive days without a bowel movement, he or she may be constipated. In such instances, it may help to add natural laxatives to the diet, such as prunes or fiber-rich foods, such as bran or whole grain bread, and consult with the doctor if the constipation continues. Also, in late-stage Alzheimer's, a person may become bedridden or chair-bound. This inability to move around can cause skin breakdown, pressure sores, and the freezing of joints. To keep skin and body healthy, relieve body pressure and improve circulation. Change the person's position at least every 2 hours to relieve pressure and improve blood circulation. Make sure the person is comfortable and properly aligned. Use pillows to support arms and legs. Learn how to lift the person. A care provider, such as a nurse or a physical therapist, can provide instructions on how to properly lift and turn the person without causing injury. Make sure not to ever lift by pulling on the person's arms or shoulders. Keep their skin clean and dry. Since skin can tear or bruise easily, use gentle motions and avoid friction when cleaning. Wash with mild soap and blot dry, and check daily for rashes, sores, or breakdowns. Protect bony areas. Use pillows or pads to protect elbows, heels, hips, and other bony areas. These are the areas that are almost always involved in pressure sores. If you use skin moisturizer on these areas, apply it gently and do not massage it in. Joint freezing or limb contractures can occur when a person is confined to a chair or bed. It's sometimes helpful to do range of motion exercises, such as carefully moving the arms and legs 2 or 3 times a day while the skin and muscles are warm, like right after bathing. But of course, consult with a doctor before starting these exercises. Another thing to think about are infections and pneumonia. The inability to move around during late-stage Alzheimer's can make a person more vulnerable to infections. To prevent this, keep the teeth and mouth clean. Good oral hygiene reduces the risk of bacteria in the mouth that can lead to pneumonia. Brush the person's teeth after each meal. If a person wears dentures, remove them and clean them every night. And also use a soft toothbrush or a moistened gauze pad to clean the gums, tongue, and other mouth tissues. Treat cuts and scrapes immediately. Clean cuts with warm, soapy water and apply an antibiotic ointment. And if the cut is deep, seek professional medical help. Protect against flu and pneumonia. And now we know against COVID-19. The flu can lead to pneumonia, which is an infection of the lungs, and it's vital for the person with Alzheimer's as well as his or her caregivers to get flu vaccines every year to help reduce the risk. A person can also receive a vaccine every 5 years to guard against pneumococcal pneumonia, which is a severe lung infection caused by bacteria. And of course, with coronavirus, right now we do not have a vaccine, but hopefully it will be available in the future. In the late stages of Alzheimer's, communicating pain becomes very difficult. If you suspect pain or illness, see a doctor as soon as possible to find the cause. In some cases, pain medication may be prescribed. To recognize pain and illness, look for physical signs. Signs of pain and illness include pale skin tone, flushed skin tone, dry, pale gums, mouth sores, vomiting, feverish skin, or swelling of any part of the body. Pay attention to nonverbal signs such as gestures, spoken sounds, and facial expressions, wincing, for example. That may signal pain or discomfort. Be alert to changes in behavior. Anxiety, agitation, trembling, shouting, and sleeping problems can all be signs of pain. And when your loved one is at the end of their life, caregivers may want to use support services such as hospice care, which focuses on providing comfort and dignity at the end of life. Hospice can be a great benefit to people in the final stages of Alzheimer's and other dementias and their families. There are also many benefits of joining a support group for caregivers. The group can act as a positive outlet, providing caregivers a regular time slot each week for social interaction outside the home. A support group offers a safe place where any negative emotions about caregiving can be expressed and validated, like anger, frustration, and grief, helping participants feel that they are not alone. Caregivers can gather ideas on how others deal with common challenges of caring for a loved one during each of the stages of Alzheimer's disease. Caregivers are given the opportunity to help others who are new to caregiving by offering tips on what has and hasn't worked well for them. Many groups offer an educational component with expert advice on caregiving topics. Support groups help caregivers maintain balance by doing something for themselves instead of always caring for their loved one.